Good evening to one and all. Warm regards from GB Chemicals and Pharmaceuticals Limited. I, Dr. Manvi Seth, would like to take this opportunity to welcome you all for the Saturday evening virtual web-based educational program. We as a company have pioneered in Metrogyl and its line extension, and now currently have entered into a new segment of wound care with introduction of a product named Cadoma, which is introduced by JB Chemicals and Pharmaceuticals Limited for the first time in India, a product which has been well accepted by most of the wound care practitioners and many dressers. We as a company have always focused on providing various scientific platforms for learning and skill enhancement across the medical fraternity. And again, this time, we are coming up with yet another skill enhancement program for the dressers who are dedicatedly devoting their time for taking care of patients and managing their wounds of different types. This dresser skill enhancement program is purely an educational initiative taken by JB Chemicals and Pharmaceuticals Limited in association with Indian Society of Wound Management. This learning module would help all the dressers across the country to enhance their skills by virtually hearing from some of the leading wound care experts. Last time, when we met, we heard from one of the leading experts talking on wound dressing. And yet today, we would be hearing from the same expert on the topic of burn wound dressing. Now, without wasting much time, and to make our evening more interesting, I would like to invite and welcome one very eminent speaker and trainer who would be training and enlightening us on the topic of burn wound dressing for today's session. Dr. Madhubari Vathulia. Dr. Madhubari Vathulia is currently working as Associate Professor in the Department of Burn and Plastic Surgery at AIIMS Rishikesh. She is MS General Surgery from Banaras Hindu University, Varanasi, MCH Plastic Surgery from Safdarjung Hospital, registered for PhD in Grauw University, Netherlands. She is also the Joint Schemes Coordinator for Mission Smile, and she has completed Craniofacial Fellowship training from Maastricht University. She has also completed visiting scholarship program at Chang Yung Hospital. It is my honor to welcome Dr. Madhubari ma'am. With this, would like to hand over the session to ma'am. Thank you.
I'm Dr. Madhubari Vathulia. I'm an associate professor from the Department of Burns and Plastic Surgery at AIIMS Rishikesh, and I'll be presenting on burn wound dressings. The rates of burn wounds are first degree, which can be equated to a sunburn, second degree, where a part of dermis is also lost, and third degree, where epidermis and the whole of the dermis is lost. So for the first degree burn, there are either dressings or no dressings are recommended. For a second degree burn, a temporary dressing or skin substitute or skin grafts can be used. And a third degree burn, we use skin or skin substitutes. An ideal burn dressing should be preventing infection, should promote moist wound healing, should prevent conversion into a deeper burn, should reduce pain and allows for movement and function and assist in decreasing swelling. The types of dressings are short-term, which is mainly sulfadiazine cream, mephinide, and mupirocin ointment. For a long-term use, there are temporary dressings which are used on partial thickness burns till the healing is complete. BioBrain, Avgat, and Suprathel come into this category. A semi-permanent dressings, basically they are used in full thickness skin loss and until the skin grafting is done. Integra and Alloderm come into this category. Now, silver sulfadiazine cream, which is a 1% cream with or without serum. They're contraindicated in burns near eyes, pregnancy, breastfeeding, newborns less than 2 months, and those who have allergy to sulfonamides. Basically, you need to see the signs of reepithelialization. So this is how the sulfadiazine cream is smeared over the burn area. Silver containing dressings, they can be transparent dressings or they need not be transparent. So basically after wetting them with sterile water, they're wrapped on the surfaces which are exposed to burns. So, and then they're retained with smaller tapes in sensitive areas. The picture shows. So this is how a silver bandage dressing is used. So you have to wet them with sterile water And once it's wet, it's placed on the surface of burn and secured with dressing pads and bandages. Silver hydrocolloid dressing, they can be used for small, medium, and large surface area burns. They're, however, contraindicated for burns near eyes, pregnancy, and those who have allergy to silver. So you can see that how a burn area has been covered with silver hydrocolloid dressing, and after the required number of days, the patient has recovered quite well. Now, bacitracin ointment are used for small surface area burns. They can be used on face, ears, and perineum, and also on graft sites. They're alternators if the patient is allergic to sulfonamides, and hence patient who cannot be subjected to silver sulfadiazine. But it's contraindicated in those who have bacterial resistance and where there are signs of reepithelialization. Mafenide acetate. So basically, ears and nose, where there are dense bacterial proliferation, you can empty around 50 grams packets in 1000 ml sterile water or 0.9% sodium chloride solution. And gauze dressings to be kept wet, and irrigation system every 4 to 6 hours has to be used. So you can see that mafenide, after applying mafenide on top of a burn wound, there are gauze pads which are kept, which are irrigated every 4 to 6 hours to keep the area wet so that the action of mafenide acetate can be ongoing. The main contraindications are for burns more than 40% of total surface area and for people who are allergic to sulfonamides. Now, chlorhexidine, this is only used for superficial burns, and that's the recommendation all over. Acetic acid. Now, this is an antiseptic topical agent which is often used in diluted form. Basically, in patients who have burn wounds with confirmed growth of Pseudomonas aeruginosa, this happens to be a wound to treat them. Synthetic and biosynthetic membrane dressings for superficial burns. Frequent changings of the dressings is not required, and epithelialization occurs underneath the dressing. So these are the main benefits of these type of dressings. Examples like BioBrain. BioBrain basically is a collagen with nylon fabric in silicone film. It's used in pediatric patients, while Abbott is actually extrapolation of the same material, which is BioBrain, but the pore size of it is all the more bigger. So you can compare the pore sizes between the BioBrain and the Abbott. So this Abbott allows more exudate drainage when compared to BioBrain. Now, Suprathel is dressing which contains more than 70% lactide polymerized with methylene carbonate and epsilon caprolactone. And over it, you apply paraffin. And after 2 weeks, you can see a lot of change and epithelialization. Amnion. Amnion is basically derived from amniotic membrane. This can also be used as a skin substitute. And this actually decreases pain and increases wound healing and decreases infection. For a full thickness burn, an autograft like skin graft, which is harvested from the patient, or an allograft, which is harvested from a cadaver, can also be used to help in healing. Now, there are some dermal substitutes in the name of Integra. Integra is basically bovine collagen with glucosaminoglycans on a dermal scaffold. Now, there is an outer silicone layer which is shown with a thin black line. After 3 weeks of application over the wound, the silicone layer is removed and it is replaced with a thin epidermal skin graft. Dermal substitutes like alloderm are also used. Alloderm is basically acellular cadaveric dermis. So this has been used in burns as well as in patients for breast reconstruction. Cultured epidermal keratinocytes, basically the human newborn foreskin is used to procure these keratinocytes. They are actually cultivated in a proper Hank's solution medium, and you can get these cultured epidermal keratinocytes. But we need a proper scaffold in order to spread these layers of keratinocytes and hence to be used on wounds. Fish skin graft, basically tilapia fish species has been used to harvest their skin, and that has been used on wounds and has been found to have reepithelialization purpose. So These fish skin can be placed over the wound for 21 days before it can be removed and checked for reepithelialization. They have shown a lot of benefit in burn wounds. So with this, I conclude my presentation on burn, and I hope that the viewers have understood the concept of burn dressings. Thank you.
Thank you, Doctor, for your excellent talk and deliberation on the topic of burn wound dressing. Your talk gave us enough clarity on the topic, and the deep and basic insights which you shared with us has surely enlightened all of us. Till now, we have covered 5 topics in this module, which are hand hygiene, hand gloving, types of wound and wound assessment, wound bed preparation, wound dressings, and this would be our last topic in this module. I hope this learning module was useful to all our attendees and it would help all of you in your day-to-day dressing activities. Also, we have a small assessment for all of you in the form of multiple choice questions that would be uploaded in the next 24 hours. You need to answer these questions for which the minimum passing criteria is 40%. Only after successfully completing these MCQs of all the topics in this module, you will be presented with a certificate from Indian Society of Wound Management. Finally, with this, would like to once again thank Dr. Madhubari ma'am for sparing her valuable time with us, and would also like to thank all our attendees for participating and making the Skill Enhancement Program a great success, which is an educational initiative by JB Chemicals and Pharmaceuticals Limited. So once again, on behalf of JB Chemicals and Pharmaceuticals Limited, thank you so much, all of you. Would once again connect with you all for such similar education programs in future. Have a wonderful evening. Stay safe, take care, and thank you.